Good morning. My name is Steve Norton. I'm the Executive Director of the New Hampshire Center for Public Policy Studies. We're the organization that has partnered with the New Hampshire Charitable Foundation and the Monadnock United Way in this needs assessment. This presentation, this webinar, is a reprise of a presentation that we gave on November 7th, 2012 in the Monadnock region. When we began this work, we first had to make a decision about what we were going to, or how we were going to define Monadnock. And we began with a whole series of different ways, including labor markets and tourist regions and housing markets. These are all important and different boundaries of the community which have important implications for different policies that the Monadnock people might be interested in. But in the end, we decided to define it based on the United Way's definition of its own service area, along with that with the New Hampshire Charitable Foundation. In essence, we combined the two definitions to come up with the least common denominator. On the right, you can see the list of towns. I'm not going to go through them, but it's quite comprehensive and includes some communities which are not normally associated with the Monadnock region per se. This work was primarily identified as a means of extending the concept of community needs. When you think about community needs assessment, this chart shows we begin with an assessment of community needs which help communities define their goals or outcomes that they're interested in amending. And then the community itself, or some of the providers within the community, often look to effective programs, and those are ones that are funded by the philanthropic efforts. And those philanthropic groups make decisions based on a series of questions that they often ask themselves, such as, can the size of the investment have an impact? Or are there other investments that could be made that would yield better results in the long term? Our goal, when we met originally with the two organizations, was to extend the concept of community needs to include both goals and some way of identifying effective programs. So the community needs assessment were all three of the pathways identified on the left. The decisions about how to fund are obviously and will obviously remain in the hands of the United Way and the New Hampshire Charitable Foundation. The original RFP identified a series of approaches that they were interested in looking at. One was to identify the needs of a community across a variety of community interests. They also wanted to increase the likelihood of either solving or significantly mitigating community problems. And they wanted to link this community needs assessment with solutions in a way that many community needs assessments haven't done in the past. That is, with this community needs assessment, they wanted to have a set of solutions identified as well as just the needs. To do this work, we began developing a technical advisory committee. This was a group of people that got together a number of times, which I'll describe in a minute, to help us understand and look at some of the data and some of the issues. This was also a group that was going to feed back to us whether this information that we were putting together made sense to them or gave them pause. This gave us really two measures then of the community needs. One, a benchmark, which we'll talk about in a little bit, and two, a different type of qualitative benchmark, which was, do these data that we are putting together surprise this technical advisory committee in any way that would suggest we need to pay more close attention than we otherwise would? The process, after forming the technical advisory committee, took about 6 months, and we began the work by identifying a whole series of domains and 153 indicators, which we reviewed with that advisory committee. And then once we had done that traditional needs assessment focus, which allowed us to identify systems and approaches to the community needs, we identified solutions which were evidence-based, which could be used to address those issues that we identified in the community needs assessment process. So to summarize, we reviewed and analyzed 153 indicators across 9 domains of the social determinants of health. A number of these areas in this work confirmed issues that have been identified in other needs assessments of the Monadnock community, including high rates of homelessness and substance abuse. But there were 3 systematic issues that emerged. One, education levels and associated downstream issues such as pregnancy and substance abuse, child welfare, and the economic viability of the community. These three came up again and again and again in looking at the indicators and data that we reviewed. In the end, and they always say we should begin with the end first and then get to the end again at the end, there was a specified interest in focusing on geography. The work that we did identified that there's significant geographic variation in the socioeconomic needs and issues in the Monadnock community, and that there are opportunities to focus their efforts, philanthropic and otherwise, on particular areas of the community. Second, related to this theme of economic viability, there were significant concerns about the degree to which the economic situation in Monadnock can support families as it may have done in the past. And there were important questions raised about what might be able to be done in the future with respect to that economic viability. There was a strong theme trying to help people understand and appreciate the best way to develop children in the community as assets for the future of the community, but also just in terms of maintaining the well-being of the community itself. And there were two that jumped out at people. One was increasing educational attainment, and the second was mitigating child maltreatment. There was also a sense to which there was a need for an acceleration or collaborative effort across the United Way and NHCF and other philanthropic efforts, including private and corporate foundations as well as the charitable trust, the hospitals in the community. Only with such a collective impact model would you be able to marshal the resources and energy necessary to make the type of change that will systematically impact the needs of the community as we've identified and as those have identified in other community needs assessments. And then finally, there was a recognition of the tension between shifting a focus to one looking at systematic interventions versus supporting basic needs such as food and basic shelter. Obviously, that decision is one that's made by the Charitable Foundation and the Monadnock United Way, but there was a recognition that both have to be part of a strategy that's supporting a community. So to date, or up to this point, you've heard us talk about a systems approach, and I want to describe a little bit of how we did this work, because this community needs assessment process wasn't so much about identifying particular indicators, but generally identifying systems that may not be functioning or working up to the benchmarks that the community might like. And anyone who has done any work looking at unhealthy behaviors or teen birth rates and the like knows that there are some systems factors which impact those significantly. And let's just begin with the big circle that you see there. That blue circle shows two areas that have a strong impact downstream on behavior and traditional measures of community need. Natural predilection to behavioral health issues and also economic status have a very significant impact on unhealthy behaviors such as drug use and drinking, which in turn impacts sexual activity, teen birth rates, and that as a result also the graduation rate and child maltreatment. And these systems are generally cyclical and they build on themselves. And looking at a system like this raises a pretty important question, and that is, where in this system or this cycle do you intervene? And where are the places or the programs that you can invest your resources to have an impact on those particular interventions? Our effort in this analysis was designed to go as far upstream in this system as you possibly could. That is to say, we didn't necessarily want to impact or look at drug use and drinking, although those substance abuse issues have been identified as community needs, but move upstream and identify those factors which drive those issues, such as educational attainment. And one of the members of the committee likened this to an interest in the community stopping people from falling off the cliff as opposed to helping them once they've fallen off the cliff. This is what we mean by systems intervention, upstream versus downstream. And just to give you an example, the literature obviously shows a relationship between educational attainment and teen birth rates, and And we've seen that relationship in looking at the data in New Hampshire as well. This just showed the correlation between child maltreatment and teen birth rates. The two are highly correlated, not necessarily causal, but it suggests that when you are dealing with these issues, they're often related to other factors which drive the relationship, and understanding that is critically important. Here's another example where we look at the relationship between child maltreatment, child abuse, and teen birth rates, and two other indicators, graduation rate and teens not in school, measures of educational attainment. And how you read this chart is, in essence, let's look at child maltreatment. As the graduation rate increases, child maltreatment decreases. That's the minus 0.4 coefficient that's identified there at the crossroads of child maltreatment and graduation rate on this table. Teens not in school, as the share of teens not in school goes up, child maltreatment goes up. And similarly, child poverty. As child poverty goes up, child maltreatment goes up. These are correlations, not causation, but it begins to show there's a system and an interrelatedness between these factors which people have been interested in. And we're really interested in going to find out what the primary drivers of these activities are, as opposed to the indicators themselves. When we began this work, we identified 9 major domains for our review, and they're listed here. And these are generally considered to be the social determinants of health, a very broad definition of health. And we looked at a whole series of indicators, which are listed here. This just shows those that we looked at with respect to education, income, housing, and one part of healthcare. But as I scroll through, you can see that we had a fairly significant number. In fact, there were 153 in all. I'm not going to go through them individually, but this data set is available for those who are interested. And again, the purpose of this analysis wasn't to provide precision with respect to any particular indicator, but rather to identify systems issues across multiple dimensions. Let's just flip back a minute and go to the social determinants of health. That is to say, what we're trying to do is not say we had a particular issue with respect to healthcare access as defined by one individual indicator. But across all those indicators in healthcare, do we have an issue that we need to focus on healthcare, or do we want to focus on education? Again, here are all the indicators. It was not a slow or an easy process, a fast or an easy process to review and discuss all 153 indicators. But the advisory team did a yeoman's job of walking through this data with us and reflecting back to us their general sense of the issues they saw. And what did we discover at a very high level, a 30,000-foot level, useful for understanding the Monadnock policy arena, is that, number one, similar to what's happening in the rest of the country and to a certain extent in New Hampshire generally, migration into the community has stopped, and in many areas you're now seeing net out migration. That creates an uncertainty about the future that needs to be reviewed and assessed. Number two, the number of children in the community has declined and will likely continue to do so absent a significant increase in in-migration of 30 to 40-year-olds. That has significant implications for the balance of resources that are devoted to children versus other community members of different ages. For example, those over the age of 65. Like New Hampshire generally, the aging population will increase rapidly over the next 10 years in the Monadnock region. The other point that we saw an increase in, though we're uncertain as to why, was we did see a significant increase in ethnic minorities, primarily in the Keene area. That may be associated with enrollment in Keene, but we did not dig too deeply into this piece of information. To give you a sense of how we reviewed the 153 indicators, we essentially aligned them up so that we could take a look at them comprehensively as opposed to individually. And this is an example of the health access indicators that we used, some of them at least, relative to the benchmark, which was the state average. And the purpose of this, again, wasn't to say we're looking for a particular indicator. Let's just take the one all the way to the left, which is % of the adults with no health insurance, and say we have a problem here or not. It was to look across all the indicators and say, relative to this benchmark, do we have a problem? And in this instance, we said, in most instances across these measures of care, we're doing pretty well relative to the state average. We also asked the technical advisory community to reflect back to us whether they were surprised or not by this information, and we used that also to gauge where we should think about focusing our efforts in our analysis, and where the community therefore might want to focus their efforts. Here's another example, healthy behaviors. A couple things to note. As other community needs assessments have identified, there is a substance abuse issue in the community relative to the state average. But again, across all these measures of healthy behaviors, Monadnock did relatively well, about equivalent to the state average across these set of indicators. This said to us that while there are particular issues that might need to be addressed, healthcare as an entirety, or at least healthy behaviors, might not be the area. And here's just another example, high ozone days. First thing to note is we didn't have great data on the environment and the environmental quality in the Monadnock region. It's something that I think most communities in New Hampshire have to work on more. But if you look at Cheshire here, this was just the number of ozone days that were in exceedance of requirements. And there were 2 in 2005. There were significantly higher in Coos and in Hillsborough County. This said to us, again, based on relatively small number of indicators, that environmental concerns were probably less across these social determinants of health than some of the other areas. So we reviewed the 153 indicators in that fashion. Again, imagine yourself looking at a set of indicators. Interest wasn't to specifically focus on any one indicator, but rather close your eyes slightly and see the general systems that were emerging and identify the major issues that bubbled towards the surface. And there were a couple. One is shown here in this analysis of the livable wage in 2007. Cheshire had the second lowest average wage as a percent of livable wage in 2007. This was a surprise to us, given the relatively high incomes in the Monadnock community, or we had anticipated. And it was also a surprise to the Technical Advisory Committee. It made them pause and think about the community in a slightly different way and the viability, economic and otherwise, of families and in their community. In part, this is a function of the fact that the drivers of the local economy have changed significantly. As you can see it on the left, between 1990 and 2000, goods-producing industries, and that was largely manufacturing, increased by almost 3.2%. The service industry and the government included as well. Goods-producing industries tend to pay more in compensation than do others. Compare that to the 2000 to 2010 picture, in which you actually saw a decline in goods-producing compensation across the time period in Cheshire. Now, this is not inconsistent with what was happening in the rest of the state. We saw fairly significant declines in manufacturing as a result of the recession. But that's also part of a long-term trend in the state. The other area where we saw significant difference relative to the rest of the state, and which gave the Technical Advisory Committee pause, was with respect to education and educational attainment. This map of New Hampshire shows the New Hampshire 2011 high school graduation rate. The darker the color, the higher the rate of graduation. People were surprised to find that many of the communities in the Monadnock region were not in the top quartile. That's the dark burgundy. They were in the second or third quartile with respect to graduation rates. This slide shows New Hampshire grade 10 and 11 math scores. And again, it shows the 4 quartiles, with the highest being the darkest burgundy. No community in the Monadnock region was in the highest quartile with respect to students with proficient scores or above. Again, this gave community members pause. And finally, one of the indicators that some studies are pointing to with respect to educational outcomes is the educational attainment of the teachers that are teaching students. Again, burgundy represents the communities within the highest quartile, and most of the communities in the Monadnock region were in the second to lowest quartile with respect to the educational attainment of their teachers. All 3 of these, I'll flip back, graduation rates, grade 10 to 11 math scores, and teacher educational attainment, as a system, they all were functioning lower than what the Technical Advisory Committee's members imagined, and also were not what they had thought the community was reaching for goals. And so people really focused on that. This became one of the areas that we returned to again and again, education and the education system. Another area that brought significant attention was with respect to children. Now, this is data that comes from the Kids Count 2011 and basically shows that for a variety of indicators, Cheshire fared worse than the communities in the rest of the state. Again, this is not about any one indicator, but it raised a question in the minds of the Technical Advisory Committee and others about the degree to which the community was supporting the children. And one area in which there were significant concerns were the juvenile arrests per 10,000 youth and the maltreatment of children per 1,000. This really raised some concerns and brought acute focus to not only education, but the question of how the community is dealing with children that might be in difficult living situations. When we brought all of this work together, this chart demonstrates how people ended up thinking about the various social determinants of health and the domains that we looked at. With respect to education, we saw a whole series of indicators that were less beneficial to the community than the technical advisory community and others had anticipated. With respect to income, higher levels of poverty, higher rate of single-parent families, and real questions about economic viability emerged. Moving down, let's take a look at behaviors for a minute. There were significant indicators of drug and alcohol abuse as well as teen birth rate problems. This was recognized and has been recognized in other community needs assessment work. But really in many people's minds, when you take a systems look at this, this is driven more by educational issues and income. And to the extent that you can impact those systems level issues, you might be able to impact those behaviors. With respect to the geography, we created an index of need, which was a tool for the Technical Advisory Committee and could be a tool for the Monadnock community generally, to pinpoint areas of particular problems. And these are the various indicators that we used. You can use other ones to the extent that they're available by town, or the data is available by town, that is. And when you aggregate them across the communities, you end up with a map that looks something like this, with areas in red being the highest areas of need from worst to best, ranking from worst to best. Not surprising, some areas, Hinsdale and Winchester, where there have been socioeconomic concerns in the past, show up in this index of need as well, but also areas like Keene do. And this is not because it has a high rate of socioeconomic issues, but because it has high numbers of socioeconomic issues as well. So what were the major findings regarding systems or upstream issues? One, educational attainment and a number of downstream issues such as teen pregnancy and substance abuse came back again and again and again as potentially problematic for the community. And there was this question of economic viability for families vis-a-vis the analysis of livable wages and the economic vitality of the community. And then the question of child welfare. How are children faring in the Monadnock community? So that was the beginning. That was the community needs assessment part. And then to some extent we got to the hard work of how is it that you can identify programs that can impact these major issues that we've identified: education, child maltreatment, and economic viability. And there was no easy solution, in fact, because there's not a lot of good work out there that allows one to look systematically at all the programs that have been identified. We took two examples to help us focus our energy and attention and really begin a conversation, but not end it, about what the right policies might be to impact these questions in the Monadnock community. Two examples: one, top-tier evidence and results first. Top-tier evidence was a national and a federal initiative designed to help Congress make their decisions about what programs they should fund at the federal level. And results first is the first part of a state-based analysis of programs. It began in the state of Washington and has been picked up by the Pew Center on the States as an organization or an effort to try and improve best practice use across the country. Both of these used rigorous standards to identify the various programs that would have an impact, and some did cost-effective analysis, some did not. Our design, or our effort, was to use these and essentially ask the question, can we identify 5 effective programs that would mitigate the issues that we identified in the community needs assessment work? And here they are. And before we get into the interventions per se, I'll say that these questions weren't, and these programs are not designed to rule out other opportunities, but to rather start a conversation in a slightly different way about the needs in the Monadnock community. So while I'm going to walk through some of these, I wouldn't want anyone to take away from this that these are the right answer for the community. Some of these may have been done before and tried ineffectively because of the characteristics of the community or the populations that are in the Monadnock community. But these are a good starting place because these are the very few limited programs that have been identified to show and showed to have an impact on the issues that were raised in the community needs assessment. So first, top-tier evidence showed Nurse-Family Partnership as a program that has strong impact on children's cognitive and educational outcomes. This was a nurse home and visitation program for low-income pregnant women. Had an impact also on child maltreatment, which was a concern raised by the community. Success for All is another program that showed school-wide reading ability effects in second grade, again, relative to the outcomes, educational outcomes. So these are 2 programs that you might want to think about as a community for beginning a conversation about how you affect children aged 0 to 6. With respect to youth, 7 to 18, a different age group, obviously different interventions. The top-tier evidence standards came up with 4 career academies, career adolescent pregnancy prevention program, life skills, etc. Each of these had a demonstrated impact on the outcomes we might be interested in. And just to give you an example, the career academies program showed that you could have long-term effects on earnings for individuals when you partner with local employers for academic and technical career training. Life skills training, similarly. This was a middle school substance abuse prevention program that showed a strong and marked impact on smoking initiation and drunkenness. Again, the purpose of this is to raise programs that were identified elsewhere as having strong and demonstrated impact and serve as a conversation starter. Results first. Initiative with respect to child welfare identified 3 with a fairly significant cost-effectiveness ratio. Again, I'm not going to go into each and every one of these, but these are programs that have been identified in the literature as having an impact on those areas where Monadnock has shown itself to be somewhat vulnerable. And the question is, should we be implementing these types of programs? And if not, what other approaches might better serve the community? With respect to education, I just want to highlight one piece. The single best program from a cost-benefit perspective that was identified in the results first work was a teaching credentialing program that complements but didn't replace state certification. This process, fairly low investment, had a big impact on teacher educational attainment and had a fairly big impact on outcomes. K through 12 tutoring by peers, reading recovery programs, and early childhood education for low-income 3- and 4-year-olds were other programs that the results first program identified as particularly valuable. So let's go back. We reviewed and analyzed 153 indicators across 9 domains. We showed significant confirmation of community needs assessments which identified some basic needs relative to a variety of different benchmarks. But 3 systematic issues emerged. 1, education levels, child welfare, and economic viability. And we also identified best practice evidence approaches which could be used as a starting point for a conversation about what the community might want to try and do to meaningfully impact these other indicators. And finally, again, to bring this back up to the 30,000-foot level, the work suggested that there's an opportunity to focus on geography. Clearly, there are areas in the community that have higher socioeconomic need than others. There is an opportunity for thinking about increasing economic opportunity through educational programs, But there are also important questions that were raised about what the community can do to ensure that it maintains that vibrant economy that existed and had organizations like Markham produce very high-paying jobs and vibrant economic community for the Monadnock area. And there was this, again, focus on increasing educational attainment and the mitigation of child maltreatment. Most of the people in the room felt like one of the most important questions they had to grapple with was how they were going to take on these system-level issues. And most agreed that one of the most important ways that they needed to do this work was to not only just combine or think or collaborate with the United Way and the Charitable Foundation, but also think and bring into the room those private and corporate foundations and charitable trusts, including the hospitals, municipal, corporate, and K-12 educations that are also trying to reach the goals of a healthy Monadnock community. This concept of collective impact pervaded almost all of the conversations regarding needs and also solutions. And finally, there was, again, this recognition that there is a basic need component to all of this work that can't be ignored. When you look at systems level issues, you're trying to stop problems from occurring, but there also is, to some extent, an obligation or an interest in maintaining the health and well-being of people at a basic level, regardless of the effort that people are trying to make at the systems level. I want to end with just saying that this community needs assessment was designed to both provide a sense of the community needs, but also the goals, and to some extent set the groundwork for a subsequent conversation, a focusing effort, if you will, to bring a level of precision to the question of impactful programs. This was not designed to make it difficult to use existing programs, but rather just a conversation restarter, if you will. The Center was very pleased to be a part of this work, and we'll look forward to following the hard work that Monadnock will do in the future. Thank you very much.